Good morning, Lynchburg Regional Business Community. If you are joining us today, you are here to learn the latest that we have from our regional partners as well as our state and federal agencies regarding COVID-19. Similar to any major disaster, this virus will have a significant impact on workers, businesses, and our economy. No family should have to face financial ruin because of loss of income, and no business should have to go bankrupt because of temporary loss of revenue because of this. To that end, we have joined the U.S. Chamber, calling on Congress to pass a coronavirus response package that provides immediate relief to businesses, the American workers, and their families. Additionally, we have added our voice to President Trump, calling on him and congressional leadership to enact the following three proposals: legislation canceling payment of all payroll taxes paid by employers for the months of March, April, and May; legislation expanding and streamlining loan programs for small businesses; and legislation enabling the creation of credit facilities to provide loans and loan guarantees to employers with more than 500 employees. Today, you will hear from local experts regarding the latest that we have. In addition to what we're doing today, you will see weekly, probably daily briefings that we will provide to keep you updated. We will host additional webinars with the latest information. To begin, I do want to thank our chamber partners and the Downtown Lynchburg Association. We are collaborating and coordinating as much as we can to provide unified information from credible sources. So we have with us today Ashley Kirshner from the Downtown Lynchburg Association and Wendy Gaylor with the Bedford Area Chamber of Commerce. At the end, we will all be fielding questions. I would ask, if you have a question for any of our panelists, that you hold those till the end, but you are free to type those to me in the chat feature. And we will be recording those and asking and getting through as many of those as we can that don't get covered during the formal presentations. Starting off, we have Michael Elliot with Centra, and we will start with him and then move through our listed speakers. So at this time, I'm going to turn it over to Michael Elliot, and if you'll give us just a minute to pull up his slides, we will get started. How do I screen share his slides? Yep. Okay, Michael.
Good morning, everyone, and blessings to you all and your families as we walk through really trying to take best care of one another throughout these times and into the future. I have just a couple of slides I'd like to review with everyone. I literally could talk about the good work that's going on all day, but we're going to get through this section in about 5 minutes, and we're going to hit some of the high points that are important for us all. The first thing is to start with why. Why are all the precautions that are in front of us being taken to begin with? And we've found this pictorial that I think explains it quite well. If you look at this first curve on this diagram, it says without protective measures, and it shows a huge spike. And going across our page, you see the dotted line that shares the healthcare system's capacity. This is not something that is pie in the sky. This is actually what we're seeing happen around the world. Without protective measures being put in place, you can very quickly outstrip a healthcare system's capacity to take care of sick patients. With protective measures, as you can see with the lower item there, we actually can keep the amount of disease spread to a level where your healthcare system can actually be prepared to take care of everyone who's sick. Once again, this is not pie in the sky. Just ask our colleagues over in Northern Italy, who are literally in a situation where they're having to decide who gets put on a ventilator and who doesn't. These are life and death causes. So the protective measures, while many feel that they have gone too far, I will tell you they need to go far, and it is for good reason. This is not something acutely that we can only deal with in the next coming days. We have to deal with it in the coming weeks and months. So what are some of those protective measures? Specifically at Centra Health facilities, visitors are prohibited at all 4 of our hospitals and long-term care facilities, in our Gretna Emergency Department, with a few exceptions. And I'm actually going to read through those exceptions because I think it's important for us to get to the details of them. Those exceptions are obstetrical patients. 1 visitor will be permitted. For pediatric patients, they can also have 1 visitor, a parent or legal guardian. Exceptions will be made for patients receiving end-of-life care, of course. Other exceptions may be considered on a case-by-case basis. An ounce of prevention is worth a pound of cure. This is all a saying that we have all heard before, but it truly plays out in this particular set of circumstances that we find ourselves in. If someone is approved to visit a patient in our facilities, they will still need to go through a screening process. And that screening process will go over several things, including, do you currently have any respiratory disease? Also, where have you traveled, and have you been in contact with someone who's had a known COVID-19 interaction? If those are the case, then you will be asked to go to another part of our facility for further instruction and will not be allowed to visit. Other protective measures that are currently in place, we have limited the entry points to all of our facilities, so we are funneling people to just a couple of entrances. The next 3 bullets really walk through capacity planning for the future. Should we get to a place where we need to take care of large numbers of sick patients, we've taken these steps with the help of our fantastic medical community. First, all non-essential surgeries and procedures have been canceled. This frees up space for us to care for the more acutely ill. Centra is also restricting routine and elective follow-up visits for patients over 70 years of age in our clinics. Patients may be contacted to move their appointments to telephone consultations to maintain medication management, prescription refills, and medical follow-up. We've also locally, across from Lynchburg General Hospital, we have the Dawson Inn, and that has been closed. The Dawson Inn is usually a place where out-of-town family and loved ones can spend the night should they need to visit a loved one long-term. We've done this in order to plan in the event that we need to repurpose the Dawson Inn for sick patients. Once again, we're planning for the future and capacity needs. Next, we are also taking steps to eliminate self-service food and drinks in our cafeterias. We're providing boxed lunches, and we are practicing social distancing any and every way that we can. Last but not least, we are accessing the ability to work from home, and we have currently several of our employees doing so. The last 2 things that I will mention is for businesses that have questions on how they can best protect their employees. We have a division of our organization called HealthWorks. It is our occupational health and business wellness arm of Centra Health. If you have questions on how to protect your employees, please call 434-200-6933. Once again, that is the main line for HealthWorks, our occupational health and business wellness arm of Centra. That is 434-200-6933. And that's for business questions. For individuals who don't know what to do if they are feeling ill, we have set up the Central Coronavirus Care Line, and anyone can call that and go through screening criteria and get directed to the next phase of care that makes sense for them. That number is 434-200-1225. Once again, the Central Coronavirus Care Hotline is 434-200-1225. Thank you, and I look forward to fighting through this battle with everybody in our community.
Thank you, Michael. Next, we will go to David Barney, who will be sharing a little bit about employer resources and what he's hearing from an insurance perspective. So, David, please share the latest and the greatest.
Thank you, Christine, and I'm happy to be here. And first, I wanted to thank Centra and their caregivers, as well as all the providers in the region, for the work they're doing to prepare to keep us safe. I know they've been working long hours and working hard. I'm going to use my time here today to discuss two major subjects. First, how the health insurance plans are handling COVID-19, and second, a summary of new legislation that, if passed, will provide significant financial relief to employees who are affected by the virus. First, let's look at some resources available to employers as you consider your response to the virus. Each of these organizations have on their launch page hot links to COVID-19 sections, and rather quickly, the CDC and WHO, they have good information on preventing and dealing with COVID-19 in the workplace. OSHA does the same. The Department of Labor, on their wage and hour section, they discuss FMLA, ADA, and FSLA, and there's lots of issues there in handling employee questions and dealing with employees regarding COVID-19. And finally, the IRS, currently there's information there on some changes in how they're handling HSA plans, as well as we would look forward to more information coming soon if legislation passes regarding employer tax credits. For health plan considerations, first subject, as you know, under the ACA, there are essential health benefits that have to be covered under health plans, group health plans. COVID-19 testing and treatments are covered services, both in terms of the medical and the pharmacy. In addition to that, carriers are offering today, and I think every major carrier in our region is offering COVID-19 testing with no member cost share on all fully insured plans. Self-funded plans may opt out of that, but I don't think that many will. In addition, telemedicine, this has been a national topic. It's been expanded by both the carriers and providers as well. So from the carrier side, most are offering telemed for free with no member cost share, and that would include locally Centra's through PCHP, Centra 24/7. That would include Anthem. They have their live health online through their Sydney app, and Cigna, Aetna, United Healthcare, Optima. They're all doing the same. You'll also see providers offering free telemed as well. Carriers are also allowing members to fill prescriptions early. And by that, I mean, if you may have a prescription that you're not allowed to fill until May, for example, the carriers are allowing you to fill those now. Obviously, hopefully it will not happen, but trying to protect the supply line for these medications coming to you. And finally, there's been a lot of discussion on treatments and how COVID-19 treatments will be handled in terms of the member cost share. I would say stay tuned on that and keep a close watch on your own carrier to see how they are going to proceed with that. On the high deductible health plans, as you know, an HDHP requires coverage to be behind the deductible. In other words, you must meet your deductible prior to your coinsurance and your copays kicking in. And plans that do not align with that format would prevent a member from using their HSA or contributing to your HSA. IRS has made a change in the HSA regulations that will allow COVID-19 testing as a preventative service, as well as treatments, to be pushed in front of the deductible. So that's a nice change for those of you on high deductible health plans. The other big topic is the Family First Coronavirus Response Act. This was passed by the House on Saturday. There was a technical correction and a vote was passed out of the House on Monday. It was delivered to the Senate yesterday. Yes, things are moving quickly. And this is under consideration today by the Senate. The president has indicated that he will sign it. And these benefits listed in this act are set to expire in the end of December. I will say that the corrected version of the act came out a little murky, and I'll share our team's interpretation as best we can. Basically, the act has two sections. The one section is emergency paid sick leave, and the act under this provision would require 2 weeks of fully or partially paid sick leave, and that is paid sick leave, for both government workers and employees of companies that have less than 500 employees. It would be available as follows. With a employee who is out sick with COVID-19, they would earn their full pay for 2 weeks. For an employee caring for a sick family member, it would be 2/3 pay for 2 weeks. And then for caring for a child who has lost their school or childcare due to the virus closings, that would also be a 2/3 pay for 2 weeks. The second section of the act is called the Emergency Family and Medical Leave Act, and that's an act within the act. This is specific to those that are caring for children when schools and daycares are closed because of the virus. What this does is it provides for employees who work for employers who have less than 500 paid Family Medical Leave Act rights for 10 weeks for those employees. And this basically starts after the first 2 weeks from the previous slide expire. So it dovetails with the prior section, and I'll show you a quick graphic representation of that. So you'll see that under the overall act, the employees affected with COVID-19 would get their 2 weeks at full pay, caring for an infected family member 2 weeks at full pay, and then the child care due to closing would be the first 2 weeks, and then that second section would add 10 more weeks of paid leave for those situations. The other provisions in the act, very important, the creation of a refundable tax credit for employers that provide paid sick leave benefits because they would be required to by the act, providing funding for economic assistance, including unemployment compensation enhancements. And then, as I mentioned before, the carriers are out in front on this, but it would actually require COVID-19 testing to be provided to members at no member cost share. Lastly, I would like to not only call your attention to the resources Michael mentioned at Centra, but also, as mentioned before, CDC, OSHA, the Department of Labor, specifically their wage and hour division, the IRS, and the state of Virginia. And for those HR professionals that are members of SHRM, SHRM has really good resources around this as well. And I'll thank you. I know these are challenging times. We appreciate the opportunity to share with you today. I'd also welcome you to go to our site. We also have a COVID-19 section where we provide a lot of useful links as well as blog posts by our own subject experts. Thank you very much.
Thank you, David. Appreciate those updates. We will go next to Stephanie Keener, who is the director of the Lynchburg Region Small Business Development Center, and she will be sharing about all the loan information that's available and any updates that are coming from the SBA. Stephanie, the floor is yours.
Thanks, Christine. As Christine said, my name is Stephanie Keener. I'm the executive director for the Virginia Small Business Development Center that serves the Lynchburg region. The SBDC network is a partnership between the U.S. Small Business Administration, George Mason University, and premier institutions throughout Virginia. Here in the Lynchburg region, we're hosted right here at the Lynchburg Regional Business Alliance. I'm going to share information directly from the SBA regarding loans and other services for small businesses. In a statement issued yesterday, the SBA outlined low-interest federal disaster loans for working capital to small businesses suffering substantial economic injury as a result of the coronavirus COVID-19. Sorry, my slides don't seem to be advancing. I'm going to try that again. Okay. I'll just go ahead. You can probably get the slides later. Upon a request received from the governor, the SBA will issue under its own authority as provided by the Coronavirus Preparedness and Response Supplement Appropriations Act that was recently signed by the president, an economic injury disaster declaration. I believe that Governor Northam may have just made that request. So as soon as we get the details about the request, we'll communicate that to Virginia businesses. The SBA's economic injury disaster loans or working capital loans are available to small businesses, small agricultural cooperatives, and most private nonprofit organizations. That would include businesses directly affected by the disaster, businesses that offer services directly related to the businesses that are in the declaration area, and other businesses indirectly related to the industries that are likely to be harmed by losses in their communities. The applicant business must have a physical presence in the declared disaster area. Examples of eligible industries include hotels, recreational facilities, charter boats, manufacturers, sports vendors, owners of rental properties, restaurants, retailers, shops, travel agencies, and wholesalers. Eligible entities may qualify for loans up to $2 million. The interest rates for the disaster loans are 3.75% for small businesses and 2.75% for nonprofit organizations with terms up to 30 years. Eligibility for these working capital loans are based on the size. You must be a small business and type of business and your financial resources. The loans may be used to pay fixed debts, payroll, accounts payable, and other bills that could have been paid had the disaster not occurred. Economic injury disaster loans over $25,000 will require collateral. Applicants must have a credit history acceptable to the SBA, and the SBA must determine that the applicant business has the ability to repay the SBA loan. The application will require a completed application, which can be found on the SBA website, that's sba.gov, tax information authorizations for the applicant, principals and affiliates for the business, complete copies of the most recent federal income tax return, your schedule of liabilities, a personal financial statement, and other information may also be requested. You should begin gathering these documents now. Our best advice is to keep good records as the COVID-19 situation is rapidly unfolding. You can keep an eye on the SBA website at sba.gov and our website, sbdclynchburgregion.org, for the latest updates. The SBDC for the Lynchburg region is maintaining a training schedule related to COVID-19, including a webinar on managing a remote workforce, which is scheduled to begin tomorrow at 12:15. You can go to our website to find out more about that upcoming series. Our other upcoming programs are moved to either webinar format or have been postponed until a later date. Our April 1st training on Canva will be hosted via Zoom. So check your email if you're already registered for training. We'll be getting that information out to you soon, and you can still register for some of that training. We also continue to meet with clients via our web-based systems and have already held multiple such consultations. You can register for that kind of conference by clicking on Schedule a Meeting on our website. And I'm going to turn it back over to Christine, and we'll try to clarify the governor's statement and make sure we have the latest information for you. Thank you.
Thank you, Stephanie. At this time, we are going to turn it over to Ben Bowman and Jason Paget, who are going to talk about the latest resources for workforce and employers and employees. So Jason and actually Ben, I don't see where you are anymore on the screen. So Jason, I'm going to turn it over to you if you don't mind starting.
Okay, I will. Let's see. All right, good morning, everyone. We'll go ahead and get started with the unemployment insurance. I'm Jason Paget, the local VEC manager here out on Oddfellows Road for Lynchburg. So the first slide is about filing a claim for unemployment insurance benefits. Employees should file a claim following your last day of work or if your hours have been reduced. I know you may be planning on staff to not work next week or to be off Friday, and some people think, oh, well, let me go ahead and file my claim. That will cause an issue for them. They need to go ahead and wait until they are actually separated from employment or the hours are reduced. Then they can go ahead and file. The information they need to file a claim, they will need their Social Security number, all employer information for the past 18 months. They will also need their bank account number. They do have the option of getting a check card that is provided by the state vendor. It's a third-party vendor. We really highly recommend that they do a checking account, or I think you can even do a savings, but checking account for direct deposit. There's a lot less issues, and if you have an issue with the check card, you do have to go to the state's third-party vendor. We're not able to help as much. And non-U.S. citizens need their employment authorization, document number, expiration date. So there are two basic ways to file for unemployment insurance in Virginia, either online at the Virginia Workforce Connection, that's here on the left, or on telephone. And you know, we are already having very large, lengthy backups on the telephone. So we do highly recommend doing the online claim. Really, the process is for someone, once you do your initial claim online, then everything takes over by the mail, and then you can do your weekly certification on the phone. But the first thing is to get that initial claim once you're separated from employment, and you can go on the Virginia Workforce Connection to do that. If you have employees that would prefer to do the telephone, they certainly can. I'm not sure if the option, you know, during normal circumstances, there's an option for callbacks. I'm not sure if the call centers will continue to do that. The agency is set up to where all UI is adjudicated and worked through the two call centers. Here in the local office, we really help people navigate. We help them complete the forms online and answer any questions to help them navigate the UI system, and then, you know, to help them get reemployed. The key thing is after they finish the online claim, then they wait in the mail, and they will get two notices in the mail. One is the monetary determination that tells them how much they qualify for, and then they have their PIN letter. Once they get their PIN letter, then they will have to file weekly certifications or weekly claims that they are available for work and that they call in to do that. So filing UI benefits due to coronavirus, the critical thing here is when you're filing your claim for unemployment benefits, the employees need to be sure to check the reason for separation as lack of work or layoff. They do not, some people, maybe you give the option as an employer that some people can take off if they want. When they're filing for UI, for unemployment insurance, if they say it's a voluntary quit, they will not qualify. They need to, it needs to be a lack of work or a layoff that will qualify them. It cannot be a voluntary quit. So that's important. When they file, because of a reduction in hours, the currently maximum weekly benefit amount is $378. So if you get paid more than the $378, that will cancel it out, and they will not get the benefit for that week. So after filing the initial claim, to follow up what I said earlier, customers must still file their weekly certification or online or by calling the 1-800 number. Or, we have found that customers do best when they do the initial claim online. They can then go back in to do their weekly certification, or you can call the 1-800 number for the weekly. That you do not have to speak to a person. It is a 5-minute automated call that they do. You have to answer questions that you go through. That shouldn't take too long. All notices from the VEC regarding unemployment insurance are mailed through the post office. So they, unfortunately during this time, we've already heard of spam and different scams that are coming around about coronavirus. Everything will come through the mail for them. Then once a customer receives his or her PIN number in the mail, they're to file the weekly certification. Work search requirements, meaning that you have to apply for 2 jobs each week. That has been waived by the governor. So that has ended on 3/21/2020, and it will be waived. So they do not have to worry about looking for work. That may change here in the future, in months to come. But right now, starting with this week ending 3/21, that work search requirement will be waived. Also, the 1-week waiting period has been waived. So local contact numbers, we are not open to the public, but we do have staff that are coming in and fielding calls and trying to direct people the best we can. So the main number is there on the screen is 455-5940. And then we also have posted on our front door and on the slide just direct lines to staff members in our cubes, the 947 numbers there at the bottom. And I can turn it back over to Ben now.
Okay. Okay. Thank you, Jason. Can you stop your screen sharing? Can you hear me, Christine?
You're good, Ben. You got about 2 minutes.
Okay, so let me try to share my screen again. Okay, so just a few things I would say is we certainly are in a very fluid situation right now. Lots of information coming down and lots of things still uncertain. But the key thing I would emphasize is that we are a regional career system, and we have a variety of partners available to provide a range of services. And I certainly want to thank Jason. They are going to take a lot of the weight when it comes to handling potential unemployment insurance claims, and I've already been receiving some requests for information and so forth regarding that. The other thing I would emphasize is that we will be receiving some ongoing guidance from our folks at the state level. We've got some regular conference calls being scheduled. And as soon as we get that information, we will post that on our websites and on our social media, Facebook. And so just want to emphasize there will be some links that I'd like to share with you. And this should be available. We've sent it out to the human resource community, the local SHRM chapter. But we have a good bit of contact information here. And if you visit these websites, the thing I would emphasize is we are trying to provide accurate and relevant information, both for employers, for businesses, as well as for the employees. And one of those items that's on the links there, we do have a frequently asked questions by employees. This is something that you can certainly print out and share with employees or share as you so choose. This is an attachment that you can access through the link, or if you email it, I can email it directly to you. Another resource that we have is workplace safety for employers, and that is something that's put out by OSHA, Occupational Safety and Health Administration. And we will continue to provide this kind of information and keep you as up to date as possible. The one thing I would say is that I know our governor has mentioned that there will be some additional assistance that will be coordinated through our rapid response teams. We do have a rapid response team that will be available to help with businesses regarding particular financial needs and assistance. So stay tuned for that.
Ben, thank you.
Thank you.
Our final presenter of the morning is Dr. Gerald Prante, who serves on the Governor's Economic Council. And we're fortunate to have him in Lynchburg at University of Lynchburg. So Gerald, welcome, and we will give you the floor.
All right, so let me share this presentation here. So basically, it's a weird situation, obviously, in America. So we might go from the lowest unemployment rate in 50 years to the highest unemployment rate in 80 years in a span of 2 months. It's that crazy. And so just looking at the Lynchburg economy, I mean, obviously healthcare is going to be big in this, but they're not going to have any layoffs in there, my guess is. So you've got manufacturing is going to be a secondary issue, but you start seeing it now with, Michigan, the automakers shutting down. And so the supply chain issues going to continue over the next few weeks, my guess is. And then, of course, you have the front lines of the coronavirus and businesses that are just being forced to shut down. And that's the retail trade and food services and so forth. And so what you're going to see in the immediate effects, businesses that rely on a heavy consumer presence, other than like the Walmarts of the world, it's just, they won't be able to survive for more than a month or two if this continues. I mean, so we're talking about restaurants and some other mom and pop shops, especially dine-in restaurants. I mean, you see that already. The unemployment claims are going to rise for them first and then everybody else next. And so revenues will likely be extremely low for many of these, and same for malls and others. And so then you have that multiplier effect. If the malls close and the restaurants close and everything else, you have less commercial real estate and less construction over time. And it's just going to have this free fall. And so the sooner we can get this back to normal, the better, obviously. For Lynchburg, hopefully, this is over by the fall and college students can return. So Lynchburg's in a unique situation, especially the Wards Roadside with all the Liberty students. As you know, Liberty has decided to now not come back, which is good on the public health side. On the other side, will have reduced business for a lot of people on Wards Road in that area. And so that could have an adverse effect for them. Hopefully we're all back by the fall. More to the college situation in a second. Now, what the government is doing, as you follow the news, the federal government, the Treasury markets, the Treasury and Federal Reserve are taking actions to try to help with credit markets. That continues. Try to help liquidity. There's a note on yesterday. I made this and I said the tax filing deadline was extended. In fact, it's just the tax payment deadline has been extended by the Treasury. So you have to still file by April 15th, but you don't have to pay until July 15th. So it's kind of like just a free extension with no interest or no penalties. And so that will help some. And then Congress will probably over the next week or so pass something to give more money to Americans. What will that help with? It'll help them pay their mortgage, pay their rent, pay their utility bill. They're not going to go out and shop much. So they're probably not going to go out and buy another car. Probably be good for Amazon. Won't be good for local stores per se, because you're not supposed to go out. And so it will help in the essentials. What they do for businesses and whether to help businesses meet payroll, that's going to be another question. In the local, one thing I would note for maybe a medium-term effect for Lynchburg is what happens with the airline bailout and then the airport. So we always hear about the airport and how it's important for Lynchburg. American Airlines obviously is the only one that serves us, and their stock's down 60% on the year. If they get a bailout, that could be good for the airport. If they get, and the terms of the bailout might matter, but also the response of consumers to air travel. After 9/11, we saw, this gradual recovery, but it took a while for airlines to get back to people wanting to fly a lot again. Will this be the same here because of some perceived, I don't want to get sick in this crowded tube that I fly in? And so that'll be interesting to see what the effect is on the airport in Lynchburg. That could be like something down the road, 6 months or a year. Also locally, this is my final slide. What are the effects going to be on local government finances? Obviously, the city and the local counties rely heavily on sales tax and meals tax revenue, and those are going to see dramatic declines. A third of a big decline in the second quarter. First quarter, a little bit, since about a third of it's been taken away. And who knows if the third quarter. And these tax bases often exempt stuff that we're still buying. So, medicines and groceries, we have special rates for those. And so the state government and some local governments will see declines, even more so than overall consumption will decline, because the essentials that people are still buying get a preferential rate anyway. So it's those disposable purchases. You'll see a big decline in those purchases, and therefore bigger decline than you might expect in sales tax revenue. I know the city has the big meals tax, 11.8%. That's going to plummet, my guess is, this quarter or this month, and we're interesting to see that. And so what will they do in response? Will the federal government step in? Will the state government step in? I know they're stepping in to help Medicaid because obviously it's a health crisis. But what will they do when we start dealing with these secondary and third order effects on government finances, and then before governments have to start raising taxes or laying off employees, teachers, and so forth? Finally, one thing to keep in mind, in about 12 days, 13 days, April 1st is the official date of the census for every 10 years. So April 1st is that date. College towns like Lynchburg rely heavily on that because since April 1st is in the school year, we get a bump from that, especially with Liberty. So those Liberty students that are on campus are classified as living in Lynchburg. And obviously that the census number affects Lynchburg over the next 10 years and how much money we get. Now, the Census Bureau has directed people to answer the question as if where you would normally be living on April 1st. Will people answer that? That's the question. Will they just say, oh, I'm living, the kid back home in Connecticut, well, I'm just living with my parents right now. Will they read the whole instructions and say, no, you were supposed to be in Lynchburg at this time, and so that's where you should put. And so that's what I'm afraid of. There's going to be this potential undercount of college students because they're not on campus right now. And so that's something to keep in mind for the city government and local governments going forward, because that affects our funding for the next 10 years on things like transportation and other things. So, all right, I'll pass it back to the folks in charge here. If you have any questions, let us know.
Thank you, Gerald. Okay, so now's the time. If you have questions, we would invite you to post them in the chat, and we will do our best to field those to the appropriate people. So, are there any questions right now? I've got both, while we're waiting on to see if there are any questions, I've got both Ashley Kirshner with Downtown Lynchburg Association as well as Wendy Gaylor with the Bedford Area Chamber on the phone. Ashley, I will start with you. If you wouldn't mind maybe sharing a sentence or two about what you want your members to know, where to go for up-to-date information, and maybe what anything else you would want them to know.
Sure, absolutely. So right now, our primary focus is actually to continue to promote visitation to downtown safely. A lot of our businesses, I'm super proud of the way that they're responding to this. They're closing their dining services inside. They're offering curbside pickup. They're offering delivery. They're really responding to what is recommended and safe right now. So what we are doing is we're gathering all that information. We are making sure that the public is aware of how they can still support small business during this time. So we have all of that information on a page on our website. The biggest thing that I want to communicate with everyone is just to continue to communicate with us. We're sending out emails almost daily, continuing to ask for that information, but just make sure to continue to use us as a resource for that. As we move forward, what we would like to be able to do is work more with the Alliance, work more with the city to make sure that all of the information you guys need is in one place. Because what I'm seeing is we're all getting so many emails, we're all getting so many updates. This briefing was incredibly helpful. As we move forward, can we put this all in one place so that you have everything you need to know to be able to keep operating your business? So that's what I would share with everyone.
Thanks, Ashley. Wendy.
Yes, hello. I am here. Can you hear me?
We can.
Oh, great. Okay. Well, we are here to help the members. We definitely want to collaborate more. We're just glad to be together on this call today. And we are wanting to work more creative with our members, providing the information that they need, just like this call is right now. And we're going to be doing that with you guys as well and do an 8-week series starting on March the 27th. These are going to be Fridays. And we want to put the information out there that our businesses need so that they can meet the challenges that will be coming ahead. And we will start with new approaches. We'll have some marketing tips. We're going to have just to create for them kind of a go-to plan, so to speak. We still want to have those connections. So the connections are going to be very important, even though they're going to look more like long-distance connections. But you don't want to miss out because you still want to have those resources, use the resources that are there. And the new norm is going to be, let's still have those connections, but they're just going to be long distance for the next 6 to 8 weeks. We're looking forward to still having our events. We have legislative breakfast scheduled in May. We want to collaborate on some things. So we're going to look forward to making things easier, not harder, and just excited about how we can co-brand and do some things that will help our members to build that bridge right now.
Wendy, thank you for sharing that. A couple of questions that have come up. And Stephanie, actually, this is for you, Jason. This question, this may be silly, but can a business owner file for unemployment?
Yes, if they have paid unemployment tax, then yes. I mean, if they have an account and paid tax and set it up, they can.
Okay.
But if the company's not, incorporated or an LLC, then sole proprietors don't. Yeah.
Thank you. A couple of questions about the slide deck and this actual call. All the slides as well as the recording of this webinar will be posted at lynchburgregion.org. Will also be made available to Downtown Lynchburg Association, the Bedford Area Chamber, and we will post on social media. So stay tuned for that if you have friends that weren't able to make the call. Another question, is there a coordinated or collective effort among businesses, local government organizations to help families in need, whether these families have been laid off from work or will potentially or soon be affected directly? Is there a point person to contact? Here's what I would say to that question. That's the sole reason that Downtown Lynchburg Association, the Bedford Area Chamber, and we are doing this collaboratively together. We're in constant contact daily in terms of what the latest information is. There is not a single point of contact for outreach for families. However, depending on what the need is, there are websites available. For instance, United Way of Central Virginia, Virginia Employment Commission, or Central Virginia Career Works Employment Commission. All of our websites will have the most up-to-date resources available. Each locality will be determining what resources are available specific to their locality. I would encourage any resident, depending on where they live, to check social media as well as websites for their locality. See if there are any other questions. SBA, Stephanie, this is for you. Currently, Virginia is not included in the areas covered by the disaster relief loans for COVID-19, according to your website. Do you currently know if our area will be included? We have clients asking.
Yeah, I expect the governor to make the request to the SBA, if he hasn't already done so, in order to release the appropriate loans to the region. I think that it's just that the situation is it's moving so rapidly that the things that we know need to be done, just, we're trying to cross as many T's and dot as many I's as we possibly can. I fully expect Virginia to be covered. It's just, that's the I that we haven't gotten to that I yet.
Thank you, Stephanie. Jason, this one's for you. There's a business that has closed for 2 weeks, and they will be reevaluating as the situation unfolds. They're paying their team full pay for this week and offering to pay any PTO they have for the next week. If they need to remain closed, will employees be eligible to file for unemployment?
Yes. Anytime that they are separated, they can file for for unemployment insurance benefits. Even the weeks that they are getting paid, paid time off, each employee may have something different. When you do your weekly claim, it is asked, did you earn any wages this week? And so if it was paid to them that week, then they need to report it. So, but your benefit year, once you file, you have the entire year to get the 26 weeks. And we expect, that there will be some extensions added on, from the federal government. So yeah, absolutely, they will still be able to file. Anytime that they are separated from work at no fault of their own, they come back and do the weekly certification. The two things, the terms that we really use, one is the initial claim. That is that's the first claim that you have to do, the initial claim. And once that is done, then you have a benefit year. And so as long as you file weekly, whether you qualify for that week or not, the claim stays open. If it goes 28 days without you doing a weekly certification, then you have to go back and do the initial claim and reopen it. But it's not a problem. You just would go back and open the initial claim.
Thank you, Jason. Let's see. A couple of other questions. Give me just a minute. Jason, another question for you. Are there options for unemployment benefits for employees being terminated and placed on 100% commission?
I mean, it really depends. If they're a 1099, I have to look that up. I really don't know. The best thing, the agency, so what happens when someone files for unemployment insurance? They put down their employer information, and the employer will receive notice from the agency. It's called a separation report. And so the employer will have to fill out, were they a W-2 employee, were they a 1099, what were the wages, what was the reason for leaving. If it's a termination with cause, then they might not qualify for unemployment insurance. What we're talking about now and in this emergency situation is overwhelmingly people that have been laid off at no fault of their own. So they will qualify. If someone happens to be terminated just because of misconduct or other stuff, then that is a telephonic hearing that you have. But no matter any time any employee files for unemployment insurance, the employer gets a separation report. So it would have to be adjudicated. And without being able to look it up, I don't want to say one way or the other. But all of these cases, are still, even though we're under emergency situations, if there's a reason for the dismissal, the separating party is anything different than lack of work. If it's a voluntary quit or if it's a termination for reason, then those are going to be adjudicated, and the person may not be qualified.
Thanks, Jason. A couple of other questions. Are there any resources for the development of policies related to an emergency like this for nonprofits? Stephanie, I know you probably have some sample policy documents. We do as well. We will make policy resources available that are going on our website similarly, I'm sure the Bedford Area Chamber and downtown Lynchburg has some as well. So depending on, I would just say check those websites. Stephanie Keener, you can find her and her website, and you can also contact us directly and we will get you some policies. Another question, are we looking at mandatory closing of non-essential businesses? You know, that's a question that could change day by day. You know, we are following the directive we get from the federal administration as well as Governor Northam. So at this point, the only directive is fewer than 10 people at a restaurant, a gym, and sports complexes. Non-essential businesses have not been required to close. It is suggested that we practice social distancing. So until we hear otherwise, we're going to proceed accordingly. Let's see. I do not see any other questions that are posted. I do want to be respectful of everyone's time. We have gone about 15 minutes over, but we do want to make sure we've answered your questions. Again, there's a webinar tomorrow on managing a remote workforce. That's tomorrow, March 19th at 12:15 p.m. Stephanie Keener with the Lynchburg Regional Small Business Development Center will be hosting that. Check all of our websites that we've mentioned for the most current up-to-date information, as well as all of our social media feeds. We are in this together, folks. It is an uncertain time, but one thing is for sure. Communities that collaborate through crisis have been proven over and over again to get through it. We will get through this together. We will provide you the most up-to-date information, and we are here for you. So with that, we will end this webinar, and we will be talking to you with timely updates as we have them. You all hang in there and have a great day.
Thank you.
Bye, everybody.